And good evening, everyone, and welcome to the Your Health is Important Facebook Live broadcast, brought to you every second and fourth Wednesdays at 6:30 by Lipodrops.com. I am Dr. MJ Collier, host, producer, and on-air personality, and we are here to answer your healthcare questions. We are so glad that you are able to join us tonight. We want all of our regular listeners to tune in. And remember, we want to know who you are and where you're listening from. So make sure you give us your demographic information, your state, your city, where you're from, and then we'll start answering your healthcare questions as quickly as possible. But let me say this. This Monday, I did something unusual. It was the first time I've ever done anything like this. I put my personal health story on the Facebook page. And I'm talking about my recent venture into weight loss. Now, I started my weight loss journey just like everybody else. I did my New Year's Eve resolution and said that I wanted to lose weight. Why? Because I had did what everyone else had done. I let that the COVID-15 creep up on me and became the COVID-20 and the COVID-30. And so I actually saw a picture of myself in an environment, and I was like, oh, my goodness, I really put on some weight. So I decided that I wanted to lose the weight. How did I want to lose it? By doing the things that I tell you to do every time we have this broadcast. Using the entire Lipodrop line of products. I use the Lipodrops Maximum formula. If you can see this bottle right here, it actually has my name on it. It says Dr. C. That's me, and I'm using it every day, one dropper full before meals to help decrease my appetite, as well as to help my body metabolize foods, particularly carbohydrates, so that belly fat will be lost. Belly fat will be lost. I'm also doing the Keto Max. I'm doing this before lunch and before dinner, about 30 minutes before lunch and dinner. I take a Keto Max tablet to put my body in an artificial state of ketosis so that it helps me more efficiently metabolize foods. So I'm doing those things. I'm also taking the Lipobiotic for GI health. This helps you digest food, deal with the leaky gut syndrome, issues that can make you not only gain weight, but particularly in the abdominal area. So this helps with the leaky gut syndrome and helps you metabolize that belly fat. So utilizing those products and also utilizing the diet program that we recommend, which is basically intermittent fasting. We offer two options: the 5 meals per day option, where you eat breakfast, lunch, and dinner, and then a snack between breakfast and lunch, and a snack between lunch and dinner. And if you're going to be up late, possibly a snack at night. But I try to really keep it to 5 times per day. But I found that intermittent fasting, one that I can really adjust to and embrace. And so I've been doing the intermittent fasting, which means I eat everything that I'm going to eat in one 8-hour period per day, and that is usually between 12 noon and 8 p.m. I like to have completed everything I'm going to eat for that day no later than 8 p.m. Now, sometimes I'll move it up. If for whatever reason I have breakfast, I may not eat dinner that day, or I still will finish it off before 6, and that's the last thing that I eat for that day. And it is amazing the amount of weight that comes off in the areas that you'd like for the weight to come off. If you can look here, my collar, I'm going to unloosen my tie just a little bit so you can see the button is still buttoned. I can get 2 fingers there. And before, I was having difficulty buttoning my shirt, and I had to, slide my tie up just to get it straight. My shirts look baggy on, my suits look baggy on, and I have some decently tailored suits, but they are no longer fitting me. As part of this weight loss journey now, I'm 3 months in and literally 30 pounds down, and I want to maintain where I'm at now. Having maintained where I am for the last few weeks, because I had attained my 30-pound weight loss objective about 3 weeks ago, I finally took the plunge. And yesterday, I purchased clothing in a smaller size. And even though I only went one size down, those clothes actually fit well, and I might even be able to go down 2 sizes, but I didn't want to challenge myself that way. Everybody is successful losing weight. The objective is being successful keeping it off. So investing in a major wardrobe change right now is where I'm at, and I'm about to do that. So having purchased those clothes yesterday, I have to say, instead of regular fit clothes, I was able to purchase shirts that were slim fit, I was able to get pants that were 2 inches smaller in the waist, and also a slimmer, more European cut. And so I was told that they actually look relatively decent when I'm wearing them. So I'm enjoying this. And the one thing that I have to say, the weight loss journey is not an easy journey, but it also doesn't have to be as hard if you use supplements that will help you obtain your objective. And the great thing about the Lipodrops line is that it helps you lose fat from areas you cannot traditionally exercise them away from, like under here. If you're starting to get, that fat under your chin, that turkey neck look, then you can lose that weight. And again, have a tight collar and a defined jawbone. The area across my back now is loose and more form fitting. I have a more appropriate hip chest ratio. So instead of being like this, now I'm like this. So I have that V shape that we like to have, and it looks, you start to wear those tighter, more form-fitting clothes, like your exercise clothes. I traveled to Miami. Some of you may have saw that video where I was looking at some medical spa type equipment. A couple of which are one that does Kegel exercises for men and women. So it's like doing 15,000 Kegels in about 30 minutes. You just sit on a chair fully dressed, and it helps you tighten up everything down there below your waist. So for women, tightens up the vagina, tightens up the rectum. If you're having leakage, particularly stress incontinence after having multiple babies, and you just feeling a little loose down there, this is great technology for you. Then there was also one that you saw me where I had my shirt lifted up and was showing off my belly. This one is like doing 20,000 crunches, and you just put these electronic paddles, and it stimulates your gut, and it contracts it, and it makes it jerk, and it really tightens the muscles up in ways you can't do it by doing sit-ups and crunches in the gym. So I'm at that point where I'm seeking to optimize my somatotype being the way that your body looks and the type of body that you have. And I have to say, you start the weight loss journey, the first few days are the hardest. You're going to be hungry, so you need to embrace the hunger. Embrace the hunger. If you don't have to fight it, you just have to embrace it and understand and make a conscious decision that although I feel hunger, I'm not going to eat beyond the prescribed times that I've given myself. When you do that, your stomach shrinks, and after a few days, then it's not a problem anymore. But I did find that, when I just had to have something, I would eat a cup of yogurt or a piece of fruit, one of these protein bars, something like that would get me through it until it was time to eat a meal. But over time, again, very successful, and I attributed it all to the intermittent fasting and the Lipodrops product line. So the things that Dr. Collier was using, again, the Lipodrops maximum formula. People say, well, what is the maximum formula? Well, this formulation is 10 times more potent than the original Lipodrops. And we have the original Lipodrops, we have Lipodrops with African mango. That product is very good at curbing the appetite and helping you metabolize fat. So it gets you through those first few days much easier, because African mango just is a natural product that cuts your appetite and also optimizes your metabolism. But what the Lipodrops is the oral equivalent to weight loss site injections called LipoVite. LipoVite works wonderfully. It contains B12, and it also contains a proprietary mixture of amino acids that are necessary to allow your body to metabolize fat in an appropriate way. Well, people come to my weight loss facility and they get the injections and they lose weight. The problem is you have to come to the office to get the injections. Well, if you take any medication sublingually, that means under the tongue, and you've seen the most common thing taken under the tongue in a period of distress is a nitroglycerin tablet. You put it under your tongue, it's instantly absorbed, and it's just like getting a shot. So when you put the Lipodrops under your tongue, it is the bioequivalent of getting a LipoVite shot. So instead of having to come back to the office and get shots on a weekly basis, you get a bottle of the Lipodrops, and you see that you use these daily, and each bottle has enough to use them daily for 1 month, and you'll get the same benefit as you are of getting the shots. So this has been a phenomenal breakthrough in the weight loss area, and individuals that have done that with the original Lipodrops formulation. Of course, people were using it and they say, well, if a little works good, a lot may be better. So people were taking higher doses. No harm to doing that. As a matter of fact, it actually gave greater weight loss benefit. So having analyzed that, we did a quick study, found out that we could optimize the product. We increased the number of ingredients by a factor of 10. So tenfold increase in the formulation now. So that optimizes. Beyond that, you really don't get any substantive benefit. You're just kind of wasting product because your tongue can only optimize. It can only absorb so much at one time. And then you also start to get with compatibility. Can it mix together well and all those things? But we did find that we could concentrate the formula in a way that was palatable. It doesn't taste bad. You put it under your tongue and you get that benefit. It helps you optimize that weight loss across the back, the outer thighs, the stomach. We call it the muffin top. So lose the muffin top with Lipodrops was our tagline. And so we are finding out that now the best thing that I can offer you is my personal weight loss journey. And we're going to show you and keep you informed as we go. If something happens and Dr. Collier starts backsliding and gaining, I'm not going to share that. I mean, I'm going to share that with you. I'm not going to hide it from you because I know that again, keeping it off is now the challenge. And I'm keeping it off by using the same products in the maintenance formulation. But I've also, again, I'm doing some routine calisthenics as well as walking regularly. I was doing those before. So that really hasn't changed. I'm about to enter a very active physical season because I'm an avid tennis player, and my first tournament is next week in Colorado. So I'm going to do that, see how we do as far as see how our health has improved, because being 30 pounds lighter to really help me move on the tennis court a lot. I'm going to find that out this week coming up. So that's the story. We want to share it with you. I'm glad that you guys found it interesting. We had a lot of clicks on it, a lot of people watching it. If you want to see that, and if you want to see all of our videos, go to our YouTube channel, Ask Dr. MJ, Ask Dr. MJ, and there are literally hundreds of videos that you can watch on a variety of health topics. We want you to go get your healthcare information and be the best you that you can be. Okay, Howdy, let's go. Let's get to our first question. Riz Miller from Memphis, Tennessee. Thank you so much for joining us. We appreciate you. Sean Big Time Green, a regular watch listener from Monroe, Louisiana. Welcome, Big Time. I told you I want you to send me some gumbo. Monica Allen from Houston, Texas. Hello, Monica. Thank you for joining. Audrey Shanae, good evening. Greetings from New Orleans. We are so glad to have Miss Ngala with us tonight. She is the Creole Queen, and thank you so much for joining us. Pam Miller, hey, Doc, from Riverdale, Georgia, local. We are so glad to see you, Pam. Thank you so much. Carla Hagney Gray, hey, this is my daughter. She is joining us. I'm so glad that she has decided to watch Daddy and see what we're doing. Shanta Jackson Pilechet, I'm hoping I'm pronouncing that, from Corpus Christi, Texas. Okay, we're going west now. In Miami, we're going south. Let's go north and South Carolina. Let's see. LaWanda Prather. Hello, LaWanda. Thank you so much for joining us once again. Who's in New Jersey? Who's in New York? Melissa Heath. Hello. Where you from, Melissa? We want to know. And again, California. Dr. Jackson, Marlon Jackson, the hip hop doc 2. Stinging B. Thank you so much. My radio partner for the longest running healthcare show. Arnita Judson from Mississippi. Okay, we're from Mid-America now. Charlene Tolson, hello. Thank you so much for tuning in as well. Rachel Harrison from New Orleans. We got another New Orleans person in the house. Thank you so much. Carol Craig. Hello, Carol. Where you from? We want to know. Remember, let us know your demographic. All right. Charlene from Maryland. Thank you, Charlene. We appreciate you for tuning in tonight as well. Okay. Riley from Florida. Thank you so much. So we got Florida covered. And everybody who listens to me on the Ricky Smiley Morning Show, we have stations in all of those areas. Penny Roberts. Hello, it's Penny from Henderson, Texas. Thank you, Penny. We appreciate you for tuning in as well. And remember, you can listen to Dr. Collier. My first segment on Rick Smiley Morning Show is always 6:45 a.m. So you can tune in and call in and ask your healthcare questions. We are live when we do that, and we take calls live. So thank you. Kathy London. Hello, New York is in the house. Now we're talking all the way. Okay, Kathy Stokes Washington. Do we have joint issues? I'm not having joint issues other than some mild arthritis. I think that's consistent with your age. Once you're out of your 4th decade, Kathy, you start to have some problems with joints. It happens. So that's called degenerative joint disease or osteoarthritis. The usual and customary treatments are anti-inflammatories to treat the inflammation. You can also take glucosamine and chondroitin, which are over-the-counter products that help tremendously repairing joints. Vitamin D and omega-3 fish oil, also very good for joint inflammation. Vitamin D is your body's natural anti-inflammatory. Omega-3 fish oils do as much as well as also, I like to say, oil the joints, so help give you some relief. So the things that we recommend, our product, the Lipo Omega, this is 1 capsule twice daily. This is very good that it helps with joint pain and also for cardiovascular health. So omega-3 fish oil is kind of God's gift to the body as far as what ails you. And as we age, we need to know that. Thank you so much, Kathy. We appreciate great question. Okay. Information about an enlarged liver. These products also help with this. I have already made my purchase. An enlarged liver is usually a fatty liver. And so as you start to lose fat, you lose the fat that's in the liver. That is a pathological condition that can happen in the liver from fat being deposited in the abdomen, from overeating, being obese, a variety of other things. You can also get it from, amazingly enough, overuse of alcohol. So we can help. Definitely, we have a detox lipo cleanse that will help with that as well. I recommend highly probiotics in addition to that. So I would take the probiotic product twice daily, the lipo cleanse to keep the gut empty, and that will help. And as you lose weight, you should also start to lose some of that fat that's in your liver as well as other places in your abdomen. So great question, Cheryl. We appreciate that. Melissa Heath says, what is good to take to build muscle mass after 50, like you lose muscle mass? Yes, you do. And as your body changes, you start to lose muscle and increase fat. Your ratios change. So the building blocks of muscle are protein. So you can eat protein. The best sources, of course, are fatty fishes and also meat. Red meat being one of the best sources of protein. But you can also get protein powders and shakes and supplements that you can put on almost anything and in almost anything. You can drink pre-mixed protein shakes that have up to 30 grams of protein in them, and that will help you build your body's muscle mass. Okay, light exercise. Also, light lifting. You don't have to do heavy lifting. Heavy lifting usually results in injury, and we don't need to do that. So you do more frequent lifting with lighter weights. That will stimulate muscle growth as well. Aerobic exercise stimulates cardiovascular fitness, and lifting stimulates increased muscle mass. So you want to mix it up. You want to have a good cardiovascular health. So do some aerobics, do some walking, some running, some Stairmaster or something like that, Peloton, and then do some light lifting with light weights, and you'll find you'll start to build muscle mass and decrease body fat. And that's the look that you want to have. You don't want to just be skinny fat. You don't want to just be slim and not look healthy. You want to have your muscles well defined and look healthy as you move it about. So skinny fat is what we're trying to avoid. Okay. Makiba, what's great. Okay, so what's the benefit of cod liver oil? Cod liver oil, again, is an omega oil that helps with your GI tract, and taking at the appropriate dose, it can work as a laxative. It also has all the benefits of most of the fish oils. It's just highly concentrated in omega-3s, and so it is good for cardiovascular health. It is good for skin. It is good for hair. It helps tremendously with all of those things. So cod liver oil, particularly if you can find it and take it in a way that's palatable. Some capsules that hold the oil until it gets into your stomach is probably best, but no matter which version you take, you're probably going to be burping up fish oil, and so you want to make sure that you eat some food so that it'll get digested out of your stomach as quickly as possible. Great question, Makiba. We appreciate you. Okay, so Brian Stewart states, hello from Oklahoma City. Is the product okay for type 2 diabetics? Yes, sir. All of our products are compatible with virtually any disease state, and we particularly target high blood pressure, diabetes, and high cholesterol because those are the disease states that are disproportionately and inappropriately affected by being overweight. Weight loss helps with each of those conditions, and there's no sugar in these products, so they won't raise your blood sugar. There's no stimulants, so they won't raise your heart rate or your blood pressure. So it's perfectly okay to take, and as most type 2 diabetics are, weight loss will help with that condition. I had a patient today in the office that has lost about 30 or 40 pounds off all diabetic medications. Now, that's unusual. Most of the time, the weight loss helps you decrease the medicines that you take for the diabetes, but it's rare that you can come off of diabetic medications. This individual was able to come off completely. His blood sugar today was 102. In the office, and I'm not even sure whether that was a fasting specimen, but that was absolutely incredible. And he showed me his history from his blood sugar monitoring. He has not had any diabetes medications for the past few months and is doing wonderfully. And he is also utilizing the Lipo line products. So we're glad to see that he has had that great benefit. That's not something that Dr. Collier would state that you can look forward to. I'm not stating, let's be clear, that you use these products, you're going to be able to come off your diabetes medications. It's important to control your blood sugar by whatever means there are. But weight loss will always help control your diabetes and possibly allow you to come off some of your medications and sometimes all of your medications. All right, great question, Brian. Marlon B. Jackson, discuss the high protein diet and how long to maintain it. Well, Dr. Jackson, we thought that the protein diet was something that you could do intermittently, and that is the entire basis of the South Beach diet. And the keto diet that you're hearing about now has been renamed the keto diet. Before it was named after the doctor that came up with the concept. And we thought that eating that high protein would result in problems like high cholesterol or diabetes. And amazingly enough, it did that. The weight loss far exceeded any potential downside to eating high fat, high protein foods. So that diet results in weight loss, and it can become a lifestyle. If you're going to go keto and live keto, you can literally do that. You never have to come off the keto diet. You can maintain it, although some people do. Sometimes they just want variety, or once they've accomplished their weight loss, they start wanting to eat the things that they haven't been eating. But most people enjoy a diet that allows you to eat steaks and bacon and all the things that you can eat on the keto diet. So the Atkins diet, which is the original name for it, named after Dr. Atkins, is puts your body in a state of ketosis. Now, again, his name has been removed from it. It's now just known affectionately as the keto diet. And the keto diet is a result of being on high protein. So high protein diets do work. They do result in weight loss. They will result in building more muscle mass, particularly if accompanied by exercise. And again, light lifting of small or lower level weights, not heavy weights. Dr. Kai does not endorse that. Invariably, it will result in shoulder injury if you're trying to do bench presses, or if you're trying to squat while carrying weights, knees, back, hips, all those things will be negatively impacted. Sometimes even push-ups can create that problem. Your arms and your shoulders are not appropriately carrying the weight of your entire body. So when you do that, if you're doing pull-ups like this and you're pulling up your whole body weight, you're using your shoulders, you can create injury, particularly if you're in your fourth decade of life or older. So let's be careful what we're doing. Make sure that you have a trainer that understands that people that are not in their 20s exercise differently than people that are younger, and to maintain health and avoid injury. Okay, great question. Jackie May, can you take a lipo if you're on a blood thinner? Yes, you can. Blood thinners does not affect that negatively or positively. It's a zero impact on blood thinners, and again, weight loss will probably help with that condition as well, because oftentimes when you're on blood thinners, it's because you've had either pulmonary embolism or deep vein thrombosis or clot in your legs or in your lungs. So it's very important that you maintain that, or if you're taking it post disease state, a heart attack or a stroke. Sometimes people on blood thinners for just a few months after one of those disease states. And if you have a second one, then you're on blood thinners for life. So if you have atrial fibrillation, multiple indications for blood thinners, but the lipo drops are not contraindicated. You can take them with blood thinners and do just fine. And they can help you lose weight under those circumstances. So great question. But always consult with the doctor that's prescribing the blood thinner. Let them see what's in the lipo drops so they can co-sign on what I'm saying to let you know. Because again, the lipo drops are basically B12 and amino acids that help your body metabolize fat, and those things are not contraindicated under those circumstances. Thank you. Tam, Scorpio's finest. Hey, Tam, I'm so glad you tuned in, because you are a regular, and we are so glad to see you. Now, a low WBC, that means low white blood cell count. Sometimes doesn't mean anything that's bad necessarily. A normal white blood cell count should be between 5 and 10. If your blood count level is 3 or 4, that's probably okay. Most of the time, it doesn't mean anything, but it can mean that your body is either under an inflamed condition, or you have an infection problem, like even an abscess that you have not been diagnosed with. So your body is constantly fighting that infection. It can be an abdominal abscess, an abscess in your buttock, an abscess in your mouth. It can be almost any, not just abscesses, but an infectious disease state that becomes chronic. Your body is constantly fighting that infectious disease state, and so it's using up your white blood cells. Your white blood cells are the cells that fight infection. Your red blood cells carry oxygen. Your white blood cells are a major part of your first defense in your immune system against infectious diseases. So particularly bacterial infections. So we need to look for an underlying bacterial infection. If I can't find one, immediately if a person can't tell me that they think they have one, it's nothing inappropriate about taking a short course of antibiotics to see if that improves it. If it does not, then you are fine. You'll be okay. Sorry, I had to take a sip break there. My voice was getting a little dry. Okay. How many products can you take at one time? The Lipo Max, the Clean, the probiotics, all of them are comparable. If you go on the website, lipodrops.com, it explains to you the benefit of the packages that are for certain criteria. You have the belly pack. You have, you want to lose more weight quicker. The combination of products and why you can take all of them. You literally could take every product in the product line, optimize your weight loss, optimize your health. Say, for instance, if you're taking Lipobiotics and you're taking the Lipo Immune as well, because you don't want to just be skinny fat. You want to be slim, healthy, but you also don't want to be susceptible to diseases. Nothing would be worse than to lose the weight to be looking good, then you get the flu or you get an infectious disease like the coronavirus, and all of a sudden now you get sick and you start gaining weight again. Or you just get sick. So you want to make sure that you maintain your health. And so there are other products in the Lipo line that are for health maintenance and optimizing your body's ability to fight disease states, like the vitamin D product, like the omega-3 fish oil, like the immuno products that are a combination of multiple things that was developed to help particularly fight some of the respiratory tract infections that we've been fighting and dealing with for the past 2 years. So great question. Okay, next. Does carrageen in protein drinks as well as other foods and beverages have a negative effect in reducing inflammation? Stay safe. Okay, I'm not familiar with what that is and whether it has a negative effect in reducing inflammation. I just know that things that will reduce inflammation, again, naturally, will be the vitamin D and omega-3 fish oil. I'm not sure whether that's the correct spelling of that. If it is, then I'm unaware of it and I can't answer that question. So thank you. Okay, Chili Wheel. I need something for prostate. What can I use, Dr. MJ? The best thing that you can do for prostate disease, make sure that it's not infected. There's 2 states of condition. There's benign prostatic hypertrophy. That's where your prostate just gets large as we age. For a male, the normal size of the prostate is about the size of a chestnut. It should be about this big. As we age, it starts to grow. You get hypertrophy or enlargement of the prostate. It can become the size of an apple. And when that happens, it starts to take up space in your pelvis, and there is no extra space in the pelvis. There are 3 things in there. There's your rectum, the prostate, and the bladder. And if the prostate starts getting large, it starts to press on the bladder, which compromises the ability of the bladder to fill. So you're having more frequent urinations because there's just no space for the bladder to expand. If it pushes backwards, it can press on the rectum and cause problems with constipation. So things that you can do for the prostate. One, the number 1 recommendation that Dr. Collier has for all men to maintain good prostate health is frequent ejaculation. So the more often you ejaculate, and that's by any means necessary, you should be emptying your prostate at least twice per week. That's the absolute minimum. You can do it twice per day. You cannot overdo it, but you definitely need to be having sex and emptying and ejaculating at least 2 times per week, man. So you tell the lady in your life that Dr. Collier said you need your medicine and you need to be able to ejaculate a minimum of 2 times per week. But again, there's no too much about it. You can do it 2 times, 3 times, 4 times, but a minimum time of 2 times. Then if you've been diagnosed with enlarged prostate, there are products on the market. There's a Proscar and there's Flomax. Both work to shrink the prostate on a cellular level. So they will give you, again, the name Flomax. It shrinks the prostate down, opens it up, allows it to, so you have urinary flow, because the urine tube, the urethra, goes right through the middle of the prostate. And if the prostate starts to grow, it grows up and in, and it starts to impinge the urine flow. So the first symptom is slow bladder emptying. So if you go to a public space like a ball game or a movie theater, and you're standing there at the toilet, and 3 young guys come and go and finish before you empty your bladder, then you know you got an outlet problem and you need to shrink that prostate. So medications can do it. Sometimes it actually results in surgery. You have to go in there and kind of grill it out, grind it out. There are multiple ways to do that. There are 2 new ways that I highly endorse and recommend. There's one with a green light laser. They stick a laser beam in there and they literally carve a new tunnel through the prostate, and that kind of seals it. It kind of sears it and seals it, so it's almost a permanent fix with a minimal invasiveness and little trauma and bleeding. They're doing a prostate procedure now with high-powered water jets, kind of like a water pick times 10, that goes in there and pulsates water and literally tears prostate tissue up in a smooth and less invasive way. Then there are ways you can literally go in there and cut it out. And that's the old fashioned technique called a TURP, transurethral resection of the prostate. That's very specific about the technique of the surgeon. So the surgeon has to have good hands, has to have good feel, so they're only taking out prostate tissue and not doing damage that could ultimately result in you having the inability to hold your urine. And that is a side effect that can happen from the old school procedure. The newer procedures work wonderfully, and if you needed surgery, but for most people, it's not a surgical issue. It's a matter of doing the 2 things that I talked about. If you have infection in the prostate, you need to go on a course of antibiotics anywhere from 2 weeks to 4 weeks. I also usually add an anti-inflammatory because the prostate is inflamed. Vitamin D helps with that also, as well as omega-3 fish oil. But the number 1 prescription, remember this, Dr. Collier is telling you, and I want you to share this information with all your friends, that the number 1 treatment to maintain prostate health, decrease the inflammation of the prostate, decrease the incidence of benign prostatic hypertrophy, prostatitis, and prostate cancer, is frequent ejaculation. If you don't take anything else home from today's Facebook Live, take that home and share it with all your friends. Thank you, Chili Will. We appreciate you, sir. Camille D. Rhonda from New Jersey. How did you get rid of vertigo? I have had this dizziness since the COVID booster. Oh, I talked about vertigo on another radio show earlier today. It can be a curse. That is when the middle ear or the inner ear, either or both, are affected. This is your balance center, and there are bones in your ear, the incus, the malleus, and the stapes that are responsible for hearing. The area that they are in the middle of the ear, have little hair-like projections that are nerve endings that orientate you, to let you know that you're standing or that you're bending over without you being able to open your eyes and see. You know, have an innate feeling of what your position is. Now, there's also the inner ear, which is your true balance center. There are 3 bones that are in 3 different planes. There's one that's flat, there's one that's about a 45-degree angle, and one that's straight up at 90 degrees. Those are also fluid filled, and they let you know the orientation of your head and your body, regardless of whether your eyes are open or whether you can see the environment that you're in. You know your orientation. Well, though that fluid can become infected, it can become too low a fluid amount, it can become too high because it's not draining appropriately, because of, say, you get a sore throat and it blocks the drainage from the middle ear. And the ultimate result is dizziness. Vertigo has 2 types, basically. You can feel like when you stand still, the room is spinning, or you can feel like you're spinning and the room is standing still. Both are basically just horrible feelings. The treatments include nasal sprays such as Flonase or nasal Cort. And you say, why am I spraying something in my nose? Because my ears are infected, because those 2 things are intimately linked. Right between your eyes, when you go straight back, the eustachian tube is right there. So you're spraying that spray to open up the eustachian tube, which can help drain fluid from the middle ear. And then a non-sedating antihistamine such as Allegra, Zyrtec, Claritin, or Zizol. Antihistamines help decrease the amount of congestion in the ears without taking a decongestant. Sometimes you also have to take a decongestant. So instead of Claritin, it would be Claritin D or Allegra D or Zyrtec D to help with that. And then sometimes in more severe cases, you have to take steroids, either injections or what's called a Medrol dose pack. And that usually will give you some relief. Sometimes you can do absolutely nothing and 10 days, 14 days later, the situation has resolved. You're saying it has not since you had the booster, so you need to be actively treated. So follow up with your primary care doctor, your family physician, or your internist, and if not them, an ear, nose, and throat specialist to see if they can give you some relief, because that is truly, you can't walk, you can't drive. It's a horrible feeling, particularly if accompanied by nausea and even vomiting. So it is a really lot of bad symptoms that are not going to kill you. You're not going to have any bad outcomes from it, but it's just a miserable existence to feel that way. Great question, Camille. Thank you. Lanita Rose, what's causing constipation when taking the vitamins? Oftentimes, you're not drinking enough water. There's nothing in the vitamins that can constipate you unless you're taking a higher dose of iron. Iron is constipating, and that's why there are actually products out there like Centrum Silver and other complete multiple vitamins that do not have iron in them, because the iron can be constipating. But if you are taking a vitamin with iron, and I do recommend that you do, because iron is necessary to prevent and or treat anemia, then you also can either take a stool softener as an artificial way to do that, or lots of water, and fruits and vegetables. If it crunches when you eat it, it's good for your gut, and it'll help keep your bowels functioning. But just remember this, the biggest problem, particularly with ladies, are you don't like to use the bathroom away from home. So you'll get the urge to have a bowel movement and won't go. And when you do that, the stool becomes drier and harder and more difficult to pass while it's sitting in your colon. So then the next time when you actually are in the comfort of your own home, you try to have a bowel movement, it's very uncomfortable, very unpleasant. You have to strain, and you give yourself hemorrhoids and all kind of other issues. So when you get the urge to go, you need to go. If that means carrying around Clorox wipes, whatever you need to do to get a bathroom that's at your workplace that you're comfortable using, then you need to use it. Or you need to establish a normal bowel habit so that you use the toilet either in the morning before you go to work or in the evening when you come home from work, so that your body's used to eliminating at a certain period of time. Everybody also has that food that will do it. It may be a cup of coffee. It may be eating some prunes or some raisins or cabbage or spinach or whatever that food is that you can eat and you know it's going to help you clean your colon out. Eat it regularly so that your colon stays empty. No sense in carrying around 5 pounds of poop in your body when you can eliminate that. It'll make your stomach flatter. It'll help keep your weight down. Your breath will smell better, and you will feel better because you're not carrying all that toxic waste. So it's very important to have regular bowel habits. That doesn't necessarily mean going every day for everybody. Some people have a bowel movement every 2 days. Some people have one every 3 days. If it's more than every 3 days, then you definitely need to do something. I have patients that have a bowel movement once every 2 weeks, yet they're eating 3 times per day. This is incredible, yet they do. But what's most important with bowel function is what's normal for you. You need to be cognizant of a change in your bowel habit. If you're used to going 1 time a day, then you should be going 1 time a day. If it's once every 2 days, if it's 3 times a day, some people go every time they eat, they get the urge and they go have a bowel movement. This is a good thing because they're not carrying around a lot of stuff in their stomach. So very good. Again, drinking lots of water. The key #1 factor in maintaining good bowel health is keeping that stool wet, moist, so it can slide easily and it can be eliminated easily. So drink lots of water, crunchy fruits and vegetables, high fiber diets will help your bowels move as well. Our colon cleanse product is very good for that. It is nothing but a fiber. There's no stimulants. It is not a laxative, but it's a great type of fiber that helps you helps keep moisture inside the colon, so it makes you have large, easy to pass bowel movements. That's our Lipo cleanse product. That's part of our belly fat eliminating. Keep your stomach flat. No bulging, no bubble gut, no bloating when you use the Lipo cleanse product. Great question, Lanita. Okay, Shanta Fuller Anderson, greetings from Savannah, Georgia. Does intermittent fasting help with weight loss in combination with your products? Absolutely, though. That's exactly what I am doing, intermittent fasting with the weight loss in combination with the products, because the products stimulate more. I would lose, and everybody does, just doing, you make that lifestyle change. I would tell people, drink an extra couple of glasses of water a day and go to an intermittent fasting plan, and you will lose weight. But if you want to lose more weight in a quicker period of time, or if you want to target, say, a belly fat in particular, then products will help you do that. So it's very important that you decide what your weight loss goal is. And then again, go to the website, lipodrops.com, see what products offer you the outcome that you like. But remember, it's also part of one of the 2 diet plans that we offer. One is intermittent fasting. The other is the 5 times per meal day, 30 grams of protein with each meal diet plan. So both are well explained on the website, and you can give you all the information that you need. But again, let's all get on this weight loss journey together. What I want to do is recruit my soldiers. We want to have the Lipodrops weight loss challenge. And just all I say, for the next 30 days, let's see what you can do. You can post your videos and starting where you start. And then it's just an honest thing. Tell the truth about whether you lost, how much you lost, and how quickly you lost. And we'll start off for the next 30 days doing that. And then after that, we can continue it for 90 days. We can go through the entire summer or go through the holiday season, because people will lose weight during the summertime. And then they want to be able, as we get into Thanksgiving and Christmas, people want to be able to go to those holiday parties at their job looking good. And we want to get that weight loss where you are. So we want to document your weight loss journey. So, upload some video showing us where you started, which products you're taking, and how much you lost. And we're going to promote that. We're going to show everybody, because everybody that's on our website are real patients. These are not fixed photos. These are not off the internet. These are real weight loss cases of people that have lost and had dramatic weight losses. We have had people that have lost 100 pounds using these products, and they look absolutely incredible. So, but what we expect from you, the standard weight loss plan, all of the 13 strip mall diets that are out there, like quick weight loss, Weight Watchers, Weight Be Gone, I'm Too Fat, all of them, they all promise you 5 pounds a month. That's really £1 pound a week, which you can accomplish doing exactly what I just said. An extra couple of glasses of water a day and intermittent fasting, you'll lose that much. So £1 pound a week, they always round it up to 5. The number sounds good. And they promise you 5 pounds per month. And that is what every standard weight loss program out there will do it. And guess what? If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight. They all work. The question and the problem is that as soon as you stop doing it, you usually gain the weight back. If you lose 20 pounds, you usually gain back 25 or 30. So that yo-yo dieting is the problem. So our objective is not to just restrict your calories and get you to lose weight. Our objective is to alter your body's metabolism so that you're more efficiently and more effectively metabolizing your foods, and it's not resulting when you eat on fat being stored around your abdomen or any other place in your body. You don't want the bulging bra straps. You break up your bra and you got bulging above and below the bra strap. You don't want to have the saddlebags on the side of your jeans poking out. You want to be able to wear form-fitting clothes that look good, not clothes that look like you've been squeezed into them. And so that's the way that you accomplish that objective, by metabolizing the fat, not just losing the weight. When you lose weight, for every 15 pounds you lose about 10 pounds of fat and 5 pounds of muscle. But when you gain it back, you gain back all fat. That's why when a person is going through yo-yo weight loss, they look differently. They've lost weight, they gain back. Their number may be exactly the same as it was when they started their weight loss journey. Let's say 200 pounds. They lose down to 160. They gain back up to 200 pounds. It's not the same 200 pounds. Now it's more fat, less muscle, so they look less healthy. We all know people that are big and overweight, but they look fit. They are firm. They look, otherwise healthy. They're just larger. That's somatotype. We all know people like that. But then we've seen people that have lost weight, had dramatic weight loss, and when that happens, they look doughy. They're soft now. Their body is less healthy. They're more susceptible to disease states like heart attacks and strokes, diabetes, high blood pressure, all of those things, because they've increased the amount of fat that their body's carrying around, and less muscle carrying around more fat is a bad combination. So our objective is not to just decrease the numbers on the scale, but for a healthy weight loss that is predominantly fat only, and that you are, so that if worst case scenario you gain it back, you're no worse off than you were, because you've only lost predominantly fat. And so when you gain the fat back, your body shape is the same, you still fit in your same clothes if that happens. But guess what? We don't want that to happen. Once you've lost your weight, we want you to stay on a maintenance program that will keep you a lean, mean fighting machine. We want you to be as healthy and maintain that weight loss. So when I first meet people who come to me for weight loss, and I tell them, what's your goal weight? What's your objective? What are you trying to do? Are you trying to lose weight for a class reunion, to fit into a wedding dress? Are you trying to, there's some event, some target that you're trying to lose weight for? And most often there is one. And I say, well, what about after that? Well, I don't want to get you ready for what an event that's happening in 2 months or 3 months. I want to know what you're going to look like in 6 months. And I want to keep that weight off of you. That is our goal. If we can come to an agreement that that's our objective, because I'm going to get it off of you. I'm going to have you ready. You're going to fit in that dress that you want to fit in, or that shirt and jacket that you want to fit in, men. If you decide, well, you now want to wear a shirt that I can unbutton and show my chest off, you'll be able to do that. That's not a problem. But we want to keep you that way, not just for that family reunion. And so the next time people see you, they say they won't even recognize you. We want to make sure that your health and your weight has been optimized, and that's what we offer and provide for you. Okay, next question. My sister wants to know, what is the quickest way to get her A1C down? A1C, or hemoglobin A1C, is a test that determines how your blood sugar and the average of your blood sugar for the previous 90 days. So it is a 3-month window into how well your diabetes is controlled. A normal A1C is less than 6.5. Greater than 6.5 is consistent with the diagnosis of diabetes. But the problem is that most of diabetics, particularly when they're first diagnosed, they're not 6.5, they're 12, they're 14. The blood sugar has been out of control for an extended period of time, and they're at ridiculous numbers. So the quickest way to get the A1C down is to get the blood sugar well controlled as quickly as possible. There are 2 new classes of drugs that will accomplish that objective I really like. There's the SGLT2 inhibitors. What they do is they block what's called the SGLT2 receptor in your kidneys, so that the sugar, which normally your kidneys filter out sugar, then reabsorbs it so it stays in your blood. But it's filtered out in urine, then it comes back in your blood, and so it's still circulating. What the SGLT2 inhibitor does is stop your body from reabsorbing it. So your kidneys will filter out the sugar, and it's not reabsorbed. So you urinate out the sugar. That lowers your blood sugar level. But guess what? When you urinate out the sugar, you also urinate out the calories associated with that sugar. So your blood sugar goes down, your hemoglobin A1C goes down, and you lose weight. Automatically, without question, you will lose weight. Not a single sit-up crunch, not going to the gym, not even significantly altering your eating habits, although you should be following a low cholesterol ADA or American Diabetes Association diet. But regardless of what your dietary changes are, you're going to be urinating out that sugar, you're going to lose weight with it. That is the beauty of these products. And once your sugar is controlled, they stop working. They're glucose dependent. So if your sugar is normal, they don't do anything. If your sugar goes up, they make you urinate out the sugar. So it does not cause your sugar to drop too low like a lot of diabetes medications can. They can't do that. So in combination with a product like metformin, which is the #1 diabetes medication prescribed, you take the metformin and you add an SGLT2 inhibitor, that will get the A1C down as quickly as possible. There's another class of drugs now, the GLP-1s. They come in tablets and they come in various injectables. Some of the injectables you take daily, you take a shot daily. Some of them, this is not insulin. This is not insulin. Or you can take the shot once a week. They're even looking at monthly shots for some of these types of medications. But the key thing is that they alter the way that your body metabolizes the sugar. They also help create a sense of satiety. You feel full, so you don't eat as much, hopefully. And they will lower your A1C as well by controlling your sugar. So some patients I have on both of those classes of drugs, as well as the metformin. And that's just amazingly how well it controls their sugar. So insulin is not the first choice to control your diabetes. Sometimes it is necessary, but insulin always makes you gain weight, no matter what type of insulin you're taking. Some of them less than others. The basal insulins like Lantus and Basaglar, the ones you take at night, have minimal impact on your weight, but they will stimulate you to be hungry. And you get hungry, you eat, you gain weight. So we're telling you to lose weight to help control your diabetes, but we're giving you insulin that makes you hungry and makes you gain weight the vast majority of the time. So if you are diabetic and you're taking insulin, see if you can come off the insulin with some of these newer products. If you're not on insulin yet, have your doctor treat you with oral medications optimally, and sometimes injections that are not insulin. This is very important for particularly people like truck drivers. Truck drivers can't keep their DOT license if they are on insulin. So it blocks your ability to support your family. And most truck drivers I know are making six figures. Now all of a sudden they can't work, they can't keep their driver's license because they're on insulin to control their sugar. Without that, they can't live. So what a lot of them do is they don't take the insulin. This is a problem. So, but there are now alternative medications that will allow you to stay off of insulin, but still control your blood sugar and help you lose weight. So those are the options. Tell her to check with her either endocrinologist or primary care doctor or internist about SGLT2 inhibitors or GLP-1s in reference to the diabetes treatment options. So if you're not being treated with either of those drugs or both, then you're not being optimally treated for your diabetes. Don't let them put you on medications that make your sugar drop too low or just insulin that makes you hungry and makes you gain weight. And you become a slave to the insulin. You have to take shots around the clock. You live for when you eat and when you take your shot. And that's your lifestyle from that point on once you're on insulin. So the objective is to avoid that if possible. And the ideal way to do that, keep your weight down, keep your A1C down. That might be the question of the day, Chili Will. You all right with me? Okay. Terrence Best. Okay, Terrence, how do I use Lipodrops Max successfully? I keep seeing different ways. Well, you can use it one time per day after your largest meal, or before your largest meal. You stick it under your tongue. You hold it under your tongue for 2 minutes, then you swallow it. Wait a few minutes, then you can eat your meal. Hold on. Okay. Or, for more weight loss quicker, you can do it after every meal. So, or before. Again, I said after twice. You take Lipodrops before you eat. So you take it, you drop it under your tongue, a drop full. When you stick it in there, it draws up the exact amount, which is one meal that you take. You stick it under your tongue, hold it under your tongue for 2 minutes, then swallow it. Okay, it works by being absorbed under your tongue. What you swallow doesn't do you any good. It has nothing to do with the benefit of the product. The product is taken sublingually, which means under the tongue. And those are the options. You can take it before one meal, your largest meal of the day, before lunch and dinner, before breakfast and dinner, or before each meal. You don't need to take it before you eat snacks. If you're going to eat a bag of potato chips, don't take the Lipodrops then. Take it before your meals, breakfast, lunch, and dinner. Particularly, the ideal way, if you're only going to take it one time per day, is your largest meal of the day, which for most people is dinner. But if it happens to be lunch or breakfast, if you're a breakfast eater and you like going to the buffet, then you do it before you go to breakfast, and you're going to notice a dramatic change in how your body is metabolizing fat. You're not storing it. And that is the basis of the eating 5 times per day diet. The biggest problem with most people that are overweight is not that they eat too much, is that they literally eat too little, or they eat everything in 1 or 2 meals a day instead of eating around the clock. How your body and your brain interprets that is that, okay, I don't know when the next time I'm going to eat. I don't like this starvation feeling. So I'm going to stimulate this person to eat. And what I'm going to do is store all of the fat, all of the food that I can as fat, which will be fuel for the body in case I don't eat again, or in case I don't eat for an extended period of time. I'll have fat, which is stored by your body as fuel for that. But if you're eating all of the time, if you're eating around the clock 5 times per day, you first start doing that, your body says, okay, I'm eating 5 times per day. I don't need to store food as fuel anymore, so no fat. So it stops storing the fat. After you've done it for a couple of weeks, your body says, hey, you're serious. You really are going to keep eating this way. So not only do I not need to store food as fuel or fat in the body, I can let go of what I have stored, because I'd rather have fresh food / fuel as a better product than having to convert fat back into fuel, which is a process your body doesn't really like to do, but it will do it. So the ideal situation is to, after about 2 weeks of doing the eating 5 times per day, the weight loss mechanism cuts on, your body starts to release fat, and you literally start to melt. And, again, you lose fat from places you cannot exercise it away from, like under the chin, across the back, in the bra line, and across the belly. Lose the muffin top when you convert your body's metabolism by eating the 5 meals per day. So breakfast, lunch, and dinner, a snack in between breakfast and lunch, and a snack in between lunch and dinner. That is the primary way that we promoted weight loss before until the intermittent fasting rage began. And we saw that, one, it works. Two, it's more compatible with some people's lifestyle. It is very difficult to eat 5 times per day. You literally have to carry food with you, have food available, because you don't have time to go purchase food 3 times per day or have it. So you would have to carry a lunchbox around like a elementary school child, or something in Tupperware, or something that you can prepare on site so that you'd have food readily available, because by the time you drive to go get something, consume it, and your downtime is gone and you're back to work. So you can't do it. So people would miss meals, and ergo the benefit of being on the 5 meal per day plan. But the intermittent fasting works in most people's lifestyle, and you can really get great weight loss with that. So those are the options right there. Okay, great question. Nikki Nicole, you're not late. This has been it. How do you get your cholesterol good, bad under control? Well, one, you alter your diet by decreasing the amount of concentrated fats that you're eating. So your preferred method of food preparation when you're eating to lower your cholesterol is baked or broiled, not fried. Frying food is the number one way to increase your cholesterol intake. You want to decrease your intake of trans fats and saturated fats. You want fats that are good, the healthy fats, the fish oils, the things that are in omegas, the omega oils. All of those are good and will help lower your cholesterol. Our omega-3 product is very good at decreasing not only your total cholesterol, but also your triglycerides. When you do or perform a comprehensive lipid panel, that includes your total cholesterol, your HDL or high density lipoprotein, the good cholesterol as you've heard it referred to, the LDL or low density lipoprotein, the bad cholesterol that's most associated with heart attacks and strokes, and triglycerides. Triglycerides are another form of fat and a byproduct of fat metabolism that is usually associated with an acute heart attack or stroke. Because when you eat almost anything, your body's triglyceride level increases dramatically. Then it comes down in about an hour or two as a part of your normal metabolism. But the total cholesterol has to build up over time. And you want that to be predominantly the good cholesterol. Your normal cholesterol level should be less than 200. Your HDL or good cholesterol should be 40 or higher. The higher that number is, the better. The LDL, the bad cholesterol, should be less than 100 ideally. If you have a history of any type of events, it should be less than 70. That means a previous heart attack or stroke. And your triglycerides should be less than 150. So those are your goal numbers, and they are easily obtainable. You can reach them, and you can do it naturally, oftentimes with diet and a combination of some products like omega-3 fish oils. Other things that will do it, red yeast rice is good for lowering the cholesterol, and some of the other oils like krill oil, etc., are very good as well. So those are things that you can do naturally. Of course, some people have a genetic predisposition. They cannot metabolize fats in an appropriate manner, so it doesn't matter. When you do all of those things, you're still not going to get your cholesterol where you need it to be. So it's going to be required that you take a cholesterol lowering medication. The number one class of drugs are called statins. That includes Crestor or rosuvastatin, Lipitor or atorvastatin, Zocor or simvastatin. Those are the top 3. In that pecking order, I think the rosuvastatin is the strongest, most potent, and works the best. Lipitor or atorvastatin, the number one most prescribed cholesterol lowering medication in the world, works great, but is not as potent as the rosuvastatin. And the simvastatin as well, I think works well as well, but is not good in combination with certain classes of blood pressure medications like amlodipine. So if you're taking amlodipine to lower your blood pressure, you have to decrease the dose of the simvastatin from 40 milligrams to 20 milligrams, or just not take the simvastatin and change to either of the other 2 cholesterol lowering statin class drugs. So very important that you do that, because if you have high blood pressure and high cholesterol, you need to control both of them, not one or the other, because that combination is what results in heart attacks and strokes. And heart attacks and strokes are what kill most people in the United States, disproportionately represented by people of color, African Americans, etc. So, okay, now we're going to close it down right here. I'm going to take one last question. Tamika Walker Hoffman, besides the UTI, does drinking a lot of water cause you to frequently urinate and cause you to feel pressure below? Drinking a lot of water causes you to frequently urinate. That's why you're flushing out
your urinary tract system, but you should not feel a lot of pressure. That could be caused particularly in a woman from an enlarged uterus or fibroids in the uterus, or you could have a chronic condition called cystitis. There are other things that are possibly causing that pressure sensation. But you stated besides the UTI, so you want to make sure that it's not a UTI, because a UTI usually results in frequency, which means you're urinating more often, urgency, which means you have the urge to go, and if you don't go, you might have an accident or wet yourself because you can't hold it, because the bladder is spasming with enthusiasm. Of course, blood in the urine is a telltale sign. So if you see blood in the toilet, or if you wipe yourself and you see blood, then that is an indication of a urinary tract infection or burning, called dysuria. It should not be uncomfortable to urinate. So if you have discomfort when urinating, something is not right. The number one reason for that is a urinary tract infection. If it's not that, you need to look for other pathology that you find in women, like ovarian cysts or fibroids of the uterus, enlarged uterus, etc. All those things are things you need to be concerned about. So it needs to be evaluated by either your primary care doctor or your GYN if it persists, because having a constant awareness of your bowel and your bladder is an unpleasant situation. You can't get through the day. You're always wondering where the next bathroom is, can't concentrate on your work. Plus, you don't want to have an accident and have to change your clothes or something like that. That's not fun, not pleasant, and something that needs to be evaluated. You don't have to live like that. There are conditions like chronic cystitis that give you that feeling. They can be treated. We want to make sure that that's not it. So one of the things we recommend is drinking cranberry juice to keep your urinary tract healthy. It does not cure infection, but it makes the bladder and the kidneys an unfavorable environment for bacteria to grow. So if you drink it regularly, it's very difficult to get a urinary tract infection. And if you have one, it can calm your symptoms down enough to get you through the weekend until you can get to the doctor or the urgent care maybe to see what's going on. Also, ladies, very important, after intercourse, you need to drink some water before intercourse, so that immediately after intercourse, your bladder is full. You can empty your bladder. That blows out bacteria that's being pushed into your bladder by the act of intercourse. And so you're not getting post-intercourse cystitis or urinary tract infections just from having sex. That's a horrible condition. You don't want to do that. It makes you not want to have sex. It makes your partner feel unappreciated, or that there's a problem. Your partner is not giving you an infection. It's just the act of intercourse that is doing it. So I tell all my patients, drink water before sex and then immediately after sex. And I know that breaks the mood. You can't lay there and snuggle. You need to get up and empty that bladder, because that blows the germs out. Now, men have the exact same problem, but the bacteria just sits in the distal part of the penis. And as the longer the penis is, the further the bacteria is away from the bladder. So they have time, and they can hold the bacteria there without getting a urinary tract infection per se. And the next time they urinate, they will just, the urine flow will remove the bacteria from their urethra. A man's urethra is literally as long as his penis is. A woman's urethra, in almost 100% of the time, is about this long, and that's not far to get into the bladder. The active intercourse pushes that bacteria up into the bladder, and next thing you know, you have a bladder infection. Okay. This brings to a close this episode of the Your Health is Important broadcast, Facebook Live, here tonight. I'm your host, Dr. MJ Collier. I hope you got some great and valuable information. I want you to tune in on the fourth Wednesday, 6:30 here. Go to our YouTube channel, ASK Dr. MJ, and look at some of the videos that we have on a variety of health topics. Go to all social media at Ask Dr. MJ. Follow me on Facebook, and I'll follow you back, I promise, and we can communicate directly. And remember, it's very important that you maintain your health. Your health is your wealth. In the words of the great Dr. Marlon B. Jackson, Stinging B. Jackson, your health is your wealth. Why? Because your health is important. Thank you for tuning in.